Hello everyone. Today we are going to learn about this erythema multiforme. So what this erythema means? Erythema is nothing but redness of the skin. So here redness of the skin will going to seen. While what is this multiforme means? Multiforme means there will be multiple form of redness of the skin will going to seen. So they can be in the form of papules, macules, or in the form of patches, in the form of different type of lesions can be seen, sometimes in the form of vesicles as well. So you can say it is in the multiple form. So the redness of the skin is in a multiple form. So we can say that erythema multiforme is nothing but redness of the skin which can occur in multiple forms. So now let us see what it is. So it is a blistering, ulcerative, mucocutaneous condition of the uncertain etiopathogenesis. So what is blistering? Means there will be blister formation can be seen. So what is ulcerative? There will be ulcerated surface is seen, which is usually painful. Or mucocutaneous, it will occur on mucocutaneous surface, and it is of uncertain origin. So here the origin will not be properly known why it is happening. And one thing you also have to remember, it is an acute self-limiting hypersensitivity reaction. So it is a acute self-limiting hypersensitivity reaction. So next, moving forward to different variants. So based on the spectrum of severity, how severe the disease is progressing, it is of different type. So first is erythema minor, second is erythema major, third is Steven-Johnson syndrome, and fourth is toxic epidermolysis necrosis syndrome, that is our TENS disease. So these are the different varieties of this erythema multiforme depending upon the severity of disease. Usually severity increases like this. In erythema multiforme there will be less severity, in major there will be more, and Steven-Johnson syndrome there will be more severity, and finally toxic epidermolysis necrosis syndrome has more severity. So now let us see each of them one by one. So you can see first let's come to erythema multiforme minor. So it is a localized eruption of the skin with a mild or no mucosal involvement. So there will be more of skin involvement will be seen as compared to mucosal involvement, and if it is involved, only the oral mucous membrane is involved, that is our oral mucous membrane, this only will going to be involved. And the skin lesion whichever is present, they show the typical target lesion. So this is the properties of this erythema multiforme minor. Now let us see erythema multiforme major. So here more severe mucosal and the skin diseases will be seen, which may be potentially life threatening in certain cases. So what will happen here, the mucosal involvement will be more as compared to erythema multiforme minor. So you can see all mucosal site can be involved here, like oral mucous membrane, esophagus, larynx, genitals and eye. So all these mucous membrane is also get involved, that's why it is a life threatening condition. So this was all about erythema multiforme major. Now next, moving forward to etiology. Now what is the etiology of this erythema multiforme? So first is different type of drugs, second is infective agents, third is virus like herpes simplex virus, and fourth is bacteria like mycoplasma. So what all are the drugs which is involved usually are these, that is sulfonamide, cephalosporin, NSAIDs, anti-seizure medicaments. So these are the different drugs that are usually lead to this erythema multiforme. Next, moving forward to this clinical features. So what all are the different clinical features of this erythema multiforme? So it is usually occur in young adult, so which is usually between second to fourth decade of life. Male here is more commonly involved than female, so here the male is commonly involved. So here also disturbed in symmetry of pattern of different organs is also seen, that is hand, legs, face and neck. And also it is asymptomatic, it is erythematous, that is redness of the skin. It can be discrete, macular or papular, or rarely vesicle or bullae can also be formed. So you can see here I have already said that it is a multiforme, that is it can be of in any form, that is macule, papule, vesicle or bullae. So that's why we are calling it as multiforme. So next, moving forward to this clinical pictures. So you can appreciate in this clinical picture, they are usually few centimeters in diameter. So you can see these are few centimeter in diameter. You can see this and this, these all are the macules, papules, vesicles are present on the surface. And also it is present in a concentric ring-like appearance. So you can appreciate here the ring-like appearance is seen. Let me zoom it so you can understand it very better. So you can see here, these all are the ring like pattern. You can see this is the outer ring, then there is a inner ring. You can also see in here one ring, then other ring. So they are present in a concentric ring like pattern. So this is the ring like pattern we can appreciate. And also it is present in a varying shade of erythema. So here varying shade of erythema, that is redness of the skin, is seen. So you can again see in this picture, you can see all this redness is seen, and it is of varying degree. That means redness will be less on the surrounding and it will be more in the center. So here the varying degree of erythema or the redness of the skin will going to be seen. So next, moving forward to oral manifestation. So which all are the oral manifestation that we can see in this erythema multiforme? So there will be pain and discomfort of oral mucous membrane, and there will be hyperemic macules, papules and vesicles is seen. So I have already told you it can be occur in any form, macules, papules or vesicles, and they are usually hyperemic. Now it can become eroded or ulcerated or can bleed freely. So sometimes it become eroded, that is the surface of the skin is not present, they become eroded and they undergo ulceration, and sometimes also bleeding can occur from that ulcerated part. And usually involved organs are tongue, palate, buccal mucosa and gingiva. So these are the common organs of the oral cavity that can involved in this erythema multiforme. So oral lesions are present along with that of the dermal lesions. So oral lesion never going to be occur alone, it will always associated with dermal lesion. So now let us see what all are the clinical pictures of this erythema multiforme. So you can see here all the lesion is involving the buccal mucosa, here the lesion is involving on the lip, here the lesion is present over the gingiva. So you can see this is the typical clinical presentation of this erythema multiforme present in the oral cavity. Now let us see what is Stevens-Johnson syndrome, one of the most important and the severe case of this erythema multiforme. So now let us see what is this Stevens-Johnson syndrome. So it is a very serious bullous form of erythema multiforme. So it is the erythema multiforme only, but of a serious bullous formation can be seen. It is a widespread involvement of typical including skin, oral cavity, eyes and genitalia. So here is a widespread involvement of the skin and different mucosa can be seen. So what is the clinical presentation? Usually there will be fever, malaise and photophobia, and eruption of the oral mucosa, genitalia and skin. So here all these ulcerated lesion of the oral mucosa, genitalia and the skin are usually seen. Lesions are similar to that of the erythema multiforme but commonly hemorrhagic. So here all these things are normal, but here the hemorrhage is seen, that is surface ulceration and bleeding can be seen in a more often condition. So now let us see the oral manifestation. So when we talk about oral lesions, they are extremely severe and painful vesicles, bullae and ulcers are usually seen, and usually thick white or the yellow exudate is coming out from these lesions, and there also erosion of pharynx is seen, ulceration and crusting of the lip is seen. So these are the typical oral lesions can be seen. So now let us see the clinical presentation. So you can see this is a typical picture of Stevens-Johnson syndrome which is seen in this baby's lips. So you can see these lips are all eroded, ulcerated and bleeding is seen. So this is a typical clinical picture of this Stevens-Johnson syndrome. Next, moving forward to eye lesion. So you can see here photophobia is seen, conjunctivitis is seen, panophthalmitis is seen, keratitis is seen, blindness is seen. So these are the different eye lesions. Next, moving forward to genital lesions. So these can include urethritis, balanitis and vaginal ulcer. So now let us see now complications of this Stevens-Johnson syndrome. So here tracheobronchial ulceration can be seen and also pneumonia can be seen. So these are the respiratory disorder that can be seen in complicated lesion of Stevens-Johnson syndrome, and there can also be secondary infection can occur. So these are the complication. Now let us see the fourth disease which is included under this erythema multiforme, that is TENS, that is toxic epidermal necrolysis, also called as an Lyell's disease. So this is the alternative name, Lyell's disease. So now let us see what it is. So here in case of TENS disease or the Lyell's disease, large sheets of skin is peel off very easily. So here the skin will peel off very easily, like what we do with boiled potato. We peel off the skin of the potato very easily. The same way here the skin will peel off very easily from the body. And also there is widespread scalding burning is seen. So here the different type of burn is seen over the area, and here the Nikolsky sign is positive. So you have to remember here the Nikolsky sign is positive. So now let us see clinical picture of it. So you can see here the skin of this lesion is peeled off very easily. You can see all this lesion is peeling off very easily. So next, moving forward to histopathological features of erythema multiforme. So this histological features is for all the different types of erythema multiforme, that is erythema multiforme minor, erythema multiforme major, Stevens-Johnson syndrome, or the Lyle's disease. So this histological feature is applied for all the lesions. So here no proper diagnostic feature is seen in this histological features of erythema multiforme, but there will be intracellular edema can be seen in the spinous layer of the epithelium. So here intraepithelial or the subepithelial vesiculation is seen, that is vesicle formation, and there can be necrosis of basal cells can be seen, dilatation of superficial capillaries and the lymphatics. So here the dilatation of blood vessel and lymphatics can be seen. Here mixed inflammatory infiltration like polymorphonuclear cell or our lymphocyte or plasma cells can also be seen. So you can see here is a typical microscopic picture of this erythema multiforme. So you can see here the necrosis of this keratinocyte is seen. So here also spongiosis, that is edema is seen, that is edema fluid is accumulated. Epidermal lymphocyte is seen, that is different type of inflammatory infiltrate can also be seen. Superficial perivascular lymphocyte is also seen. So this is the typical picture, and you have to remember one more thing. You can see that is here the destruction is occurring into the basal epidermal layer. So here the destruction is occurring in the basal epidermal layer. So you have to remember that. Now next, moving forward to diagnosis. So how we will diagnose this erythema multiforme? The clinical presentation is similar to that of the other vesiculobulbous diseases. Direct and indirect immunofluorescence finding are not specific. So here the immunofluorescence finding will not help us much to diagnose the disease. And when we talk about the treatment, the treatment will be depend upon which stage it is, the severity of it. So here the corticosteroid is one of the preferred drug which will reduce all the signs and symptoms of this erythema multiforme. So this corticosteroid can be used in the form of topical application and can be used as a systemic application, that we can take it as orally or parenterally.